So I think we'll just go ahead and get started. So welcome everybody. It's really nice to have all of you here. My name is Elizabeth Dvergsten-Beauce, and I'm a social worker with Lung Cancer Canada and the Airways of Hope program. Today, I'm joining from Treaty 1 territory, which are the lands of the Anishinaabe, Cree, Ojibwe, Dakota, and Dene peoples, and also the homeland of the Métis Nation. This is the third webinar in a new educational series that the Airways of Hope program launched this past summer. So the two previous webinars, Moving Forward After a Cancer Diagnosis and Coping with Scanxiety, can all be found on the Lung Cancer Canada website under Resources and then Videos. So as with those two previous presentations, the first part today will be recorded. It's about half an hour long, and then that'll also be posted on the Lung Cancer Canada website under Resources and Videos. There will be time for questions and discussion during the second part of the hour, and that part will not be recorded to respect confidentiality and to allow a really safe space for a conversation to happen. So who is this webinar for? Well, advanced care planning, it's a process that comes up a lot in conversations that I have with patients and loved ones. It's a planning process that involves patients, caregivers, circles of support, and even healthcare providers and other professionals. It's really a process that's important for anybody, really, any adults of any age, but particularly important for people living with cancer and lung cancer at that, really at any stage of diagnosis. And any stage of the cancer continuum. I've heard advanced care planning described as ominous, as scary, as overwhelming, and more. But I've also heard it described by people after they've completed it as a really empowering, relieving, and comforting process, knowing that their affairs are in order. So in today's presentation, let's see here, there we go. In today's presentation, we'll explore various components of advanced care planning, and we'll also identify strategies to complete your own plan, and then we'll discuss ways to start meaningful conversations with important people in your life. Most of the information presented today is adapted from two online resources, Advanced Care Planning Canada and Dying with Dignity Canada. So those resources will be made available to participants via email after the presentation today. Advanced care planning really can involve many different aspects of life, as well as many different professionals, whether it be lawyers or financial planners or doctors. This presentation today is provided through my lens as a social worker. So it's intended to really start the conversation about what advanced care planning is. And we won't necessarily get into the nitty-gritty details, and we'll talk about that in a bit and why. But we just really recommend that patients seek assistance from additional professionals for medical or legal or financial advice. And as always, a gentle reminder that if anything from today's conversation brings up questions or concerns that you might have, please talk to your healthcare team or even reach out to myself or my colleague Michelle at Lung Cancer Canada. So advanced care planning, lung cancer, as you all know in various contexts perhaps, but lung cancer turns worlds completely upside down, and there can be so much uncertainty and unknown. The primary focus is obviously on the patient's physical health, discussing treatment and care options, but finding ways to take meaningful action and feel a sense of control is really important for lung cancer patients and their loved ones. So advanced care planning in that context is really at the heart of being an empowered patient or caregiver. But again, I often hear that it's very overwhelming and ominous for people, and they have no idea where to start, understandably. But that's what this presentation is here for today. There are meaningful ways to move through this process with a bit of guidance and direction. So what is advanced care planning? Well, it's really a process that involves making decisions for your future care when you have the mental and cognitive capacity to do so. It's more, it can be this, it can be a binder of documents, but it's also more than that. It's a process of reflection and communication that does take some time. By planning ahead and completing your own plan, You can better direct your care in the event that you're unable to make decisions for yourself. You can avoid unnecessary suffering. Through advanced care planning, you can relieve caregivers of decision-making burdens during those moments of crisis or grief when decisions need to be made. It can also help you to reduce confusion or disagreement about the choices you would want people to make on your behalf. It's really the best way to ensure that your wishes are known. So a few things to remember that's really important as we're starting this conversation about advanced care planning is that this plan would only be used if you are not capable of making decisions for your care. It's really a living document in that way, and you can change your decisions in this plan at any time. It's important that you, throughout this process, feel respected and that you trust the individual or individuals that you might name in your plan. So there are a few things to keep in mind as we're kind of starting this conversation about advanced care planning. The legal framework for advanced care plans really varies across Canada, as does the terminology. So I've just put this, this image up here to kind of help place yourself depending on where you live and what terms are used. So first of all, again, no one is required by law to have a plan or to have any of these documents. We really just want to make that clear from the get-go that this is all voluntary and nobody is legally required to have these documents. Not all provinces and territories have laws actually that permit appointing a substitute decision maker or one of those other words that are used to describe a substitute decision maker. And not all provinces and territories have a legally enforceable advance directive that can actually be used. So it's really important to look into what you need depending on where you live. And also to kind of keep a note, some provinces and territories don't require an advance care directive to be notarized, but to ensure its effectiveness, many people do seek professional support either from a lawyer or a financial planner to kind of make sure that they have all their T's crossed and their I's dotted. So, really, again, what I'm presenting today is a template that you can personalize depending on your own needs and where you live. So some components of an advanced care plan, there are really excellent tools online, again, from those two places, those two sources that I mentioned before, Advanced Care Planning Canada and Dying with Dignity Canada, that you can fill in on your own. So those I would encourage everybody to take a look at those two websites to really kind of get into the nitty-gritty, and they have those plans that you can follow step by step, which can be really helpful. And they all really include a variation of the following categories: values and wishes, medical, financial, and legal. And again, it's just important to remember that, each of these situations, as we talk about them, will be unique to each individual patient and also should be revisited regularly, knowing that life circumstances and health can change, quite quickly sometimes. So when we think about values and wishes, in determining your wishes, think about your values and what's important to you in your life right now, and what might be important to you in the future, either in time of serious illness or injury or at the end of life. Some things to consider in this category: consider how important it is to you to be independent and self-sufficient. Where are you at on your healthcare journey? Identify what circumstances might make you feel like your life isn't worth living, where you might want to take different steps in terms of your medical care. Think about what you might want for treatment, maybe to extend your life in any situation or all situations, or what treatment you would want only if a cure is possible. These are all kind of various questions that can come up. And a lot of these conversations revolve around the themes of quantity and quality of life, and again, are very circumstantial. We could never possibly think about all of the potential scenarios where we might need an advanced care plan. The goal, again, is just to get the conversation started. So these are a few other questions, and these next two slides, this slide and the next, are taken directly from Dying with Dignity Canada website. So this is I've included this to kind of give you an idea of what this process can look like and guiding you through these conversations with yourself, but also with others. So, kind of just going through and rating how important these things are for yourself. Again, right in the present moment, but also thinking about your future self and what might, different scenarios that might come up in the future. When we think about medical goals of care can be curative, rehabilitative, life prolonging, or comfort focused. So that's one of the helpful things to think about as you're going through some of these questions and scenarios. They might include decisions about medical interventions, such as resuscitation, mechanical ventilation, dialysis, feeding tubes, pain management, various medications. And documents that you might include in this section are all related to those different categories. So they could include organ and tissue donation documents, medical powers of attorney or substitute decision maker documents. Again, all depending on where you live, the language might look differently, but an advanced care directive is basically a document that would state all of your wishes in all of these different categories. And, reflecting upon your medical goals of care in this plan can really help people to clarify their wishes for their overall medical care, including at the end of life. So when we think about financial and legal preparation, this includes many subcategories such as banking, estate planning, insurance plans and pensions, wills. Again, nobody is required by law to have any of these documents. But again, depending on your own situation, these are some documents that you might include in your advanced care plan. Appointing a substitute decision maker, or again, whatever term is used depending on what province or territory you live in, it is recommended if you own property, have money or investments that need to be managed, or if money might be needed from your accounts to pay for living expenses right now or in the future. So it's just, something to kind of keep in mind. Some documents that you might include in this section might include a power of attorney, an advanced directive, or a living will. Again, those terms vary depending on where you live. Maybe copies of pensions or life insurance policy, deeds to land or house titles. Again, really, the list could be, pretty extensive or pretty short, depending on your own circumstances. And again, there are some free resources online to complete these documents, which are really helpful starting points and might be sufficient for your own advanced care plan. But if you do have any questions or concerns, don't hesitate to reach out to a professional to answer any questions, whether that be a doctor, your oncologist, a lawyer, a financial planner, whomever that might be in that relevant situation. And again, it's really, impossible to think about every single scenario, but that's not the goal of this process. The goal is to start conversations which can help to direct your loved ones in the event that you're unable to communicate for yourself. That's the overall goal with this whole advanced care planning process. So how do we get started? That's a great question that everybody always asks. Where do I start? I know I need this or different components of this, but where in the world do I start? These 3 steps, as I've laid out right here, can be a really helpful guide to get started. So first of all, identify your goal. What do you want to complete? So what's the overall focus for your plan? Is it just medical or financial, or does it include all of the above? And also another way to think about it, if you needed this plan next week, what would you need to complete right away? What would you definitely want in that plan that would help you in the context or scenario that you might need that right away? Second, clarify your purpose. Why do you want to complete this plan? Is it to feel prepared? Is it to have a sense of control or empowerment? Is it for your loved ones so these decisions aren't a burden for them? Is it to get your affairs in order and to feel that sense of control when everything else feels turned upside down? Be really clear about why you want to complete this, because that can help give you fuel to keep going through this process. And then lastly, Identify sources of support. Who and what can help you to complete these tasks? Is it family or friends, professionals, maybe your healthcare team? Is it a counselor or a social worker like myself? There's lots of people that can help get this going and to help you complete this plan. And as I mentioned, there's also resources online that can really help make this as easy as possible. So some strategies to get started on your advanced care plan. First of all, prioritize your needs. So again, that question of, if you needed this next week, what would you need right away? So prioritize and, figure out what comes first in importance. Another strategy to get started is to think through the lens of SMART goals. So SMART stands for specific, manageable, achievable or realistic, relevant, and time-specific goals. And these are ways to take meaningful action that come in bite-sized pieces that don't feel too overwhelming. So using that SMART acronym can be a really helpful way to kind of get a hold of it. And then lastly, I hear from some people sometimes that having a buddy plan or somebody to help kind of keep you accountable or just to kind of help brainstorm or guide you through this process can be really helpful and meaningful too. But as always, exercise your best judgment when sharing personal information with people. But it's another way that I hear that people feel can be helpful to get through their planning process. So, talking to your loved ones, particularly those who you may have named in your plan, either as a power of attorney or a substitute decision maker, it's really important. But I often hear from people that it feels overwhelming and they're not even sure how to start those conversations. So, it can be hard. But here are a few ideas that comes from the Dying with Dignity website. So, conversation starters. I attended a workshop yesterday on advanced care planning, and I was encouraged to talk to you today about my values and beliefs. I'd like to talk to you now while things are still fresh. Or here's another conversation starter. What I'm asking to talk to you about today might be tough, but I need to talk to you now about what I want in the end of my life and how I want that to look like. And here's another idea. I was thinking about what happened to, so-and-so's family member who died, and it made me realize, and then you can start the conversation that way. A few more ideas. I want to talk to you about something that's really important to me, and I need to plan for the future. So can you help me with that? I'm okay now, but I want to be prepared, and I'm concerned that. And lastly, I know it's really tough for you to think about me dying, but if we talk about it now, I'm still here to help you move through that. So those are some really, great ideas about how to get those conversations started. And when you are starting those conversations, be very simple, direct, and specific about what it is that you're talking about. And the reason for this is because it'll help others to really hear what you're saying. If you simplify things, you keep it straightforward and very specific. And a bit of strategic planning can really go a long way in helping these conversations go as smoothly as possible. So again, think about who you want to talk to, when and where you'd like to have those conversations, what you want to say, and think about too if you want to talk to people individually or as a group. And also think about if you'd like to have someone with you to support you in having these conversations. It's also equally important to talk to your healthcare team and other professionals. And these same questions apply to those healthcare providers. Plan ahead and know what you want to say. Communicate your desire to have these conversations ahead of time so they can prepare. And then again, be very simple, direct, and specific. Patients that spoke to their healthcare providers, I've heard that they have less fear and anxiety. They have felt that they had more ability to influence and direct their medical care. They believed that healthcare providers had a better understanding of their wishes. And it also indicated a greater understanding and comfort level than they had before those discussions took place. So it goes back to that idea that, getting started with advanced care planning can be really overwhelming. But once these conversations happen, it can be a very meaningful process, and it can help to feel very empowered when things feel very out of control. So again, we kind of talked very briefly about the various components of an advanced care plan, which includes identifying your values and wishes, as well as medical, financial, and legal components. And we also mentioned and kind of explored briefly how important it is to identify your goals and what it is that you want to complete, your purpose or reason for completing a plan, and then various supports that are available to you, whether it be loved ones or other professionals or even online resources. And some tips to get started, we identified were to prioritize your needs and use a SMART acronym, that SMART goal acronym, to get started. And if it feels like a good fit for you to have a buddy system, that can also help things to move along. And having these conversations and making a plan are really ways for your wishes to be known and to give your loved ones the confidence to make these decisions during a difficult time. And inviting them into the conversation and being very specific and simple and direct can go a long way, as does a bit of strategic planning ahead of time, so things can go as smoothly as possible. And just important tips or important notes to remember that an advanced care plan for one person can look very differently than it does for another person, depending on the context and also the location, province or territory that you live in. And also, you are in control of this process every step along the way. It's a living document, so revisit them regularly and know that, what you have planned in one moment might look differently down the road, whether it be a month or 6 months or even a couple of years down the road. You're not alone in this process, and you don't have to go through it alone. An advanced care plan can feel really overwhelming and ominous, as I've heard people, mention it before. But going through the steps slowly can help to restore a sense of control and empowerment in a world where lung cancer has turned everything upside down. Again, it's important to consult with your healthcare team, talk to a counselor or another professional, and reach out for support from loved ones. This is, again, meant to be empowering rather than overwhelming. And lastly, I just want to recognize and acknowledge that most of the information from today's presentation came from the Advanced Care Planning Canada website and the Dying with Dignity Canada website. So they both have different documents that you can fill in to help you with the planning process. But use it as a good conversation starter and a good way to start thinking about advanced care planning. So thank you very much again for joining us today. Stay tuned to the Lung Cancer Canada website for news of our next upcoming events and webinars, later on this winter. And again, don't hesitate to reach out to myself or my colleague, Michelle. We are here to offer you support at any step along the way. And if advanced care planning feels like it's something you want to participate in right now and you need a little extra support doing so, that's definitely something that I can help walk through that process with you. So definitely reach out if you have any questions or would like some extra support. So at this point, we'll stop recording and then we'll shift to questions and discussion about advanced care planning.